Hey everyone, so we're going to chat about polycystic ovarian syndrome. And if you've been following some of the posts lately from the last couple of weeks, there's been a few new research studies talking about polycystic ovarian syndrome. And I think it is groundbreaking because we're looking at about 70 plus international organizations that are completely dedicated to the research of polycystic ovarian syndrome, and they're updating guidelines in almost 31 countries. So our approach to looking at polycystic ovarian syndrome, how to recognize the symptoms, how to treat it for infertility is totally different. And the Canadian guidelines have not been updated for this yet, so it's really important we talk about it because the power is, in a patient-doctor relationship. And if you're paying attention to this, and you are in a better position to advocate for your own health. So first things first, with polycystic ovarian syndrome, it's a condition that about 1 in 10 women will be diagnosed with in their reproductive life. And during that timeline, it takes about 7 years. I think that's the estimate from some of the research in Canada. When you first show up to a doctor with some signs of polycystic ovarian syndrome to when you actually receive an official diagnosis, which is a huge gap. So the 7 year gap in that time, we can accelerate the treatment and recognition of the symptoms quite sooner. So first things first, if you get symptoms while you're in your teenage years, it should be tested. We should be doing like the full, thorough work through of how to diagnose polycystic ovarian syndrome. So they had recommended this new update with the guidelines that if you're having irregular cycles for more than 2 years, so irregular cycles being less than 21 days or greater than 35 days, and it keeps alternating, or it's just one or the other, we should be doing through a full workup for polycystic ovarian syndrome. And most importantly, I think the most common thing when you come in with like an irregular cycle is you get put on the birth control pill. So it's important to note that if you're getting testing for polycystic ovarian syndrome, you actually have to come off the pill for 3 months. And I think that's a gap that a lot of people who've been tested, it's missed. You don't come off the birth control, you're taking the birth control, we do the testing, and then it's a false negative. So we kind of mask the blood symptoms of, hi Felicia, hi Dr. Felicia. And so we miss those symptoms. So it's important we come off the birth control for at least 3 months. And when we're doing the blood test, it's important that when we check for signs of hyperandrogenism, so high or elevated male hormone or male androgen hormone, we also check for a very specific type. So free testosterone is the one that's recommended, or bioavailable testosterone. So bioavailable testosterone is bound to albumin, so it's readily available for us to use in the body, or it's circulating as free testosterone in the blood. So both of those are very accessible forms of testosterone for us in the body, whereas we have bound testosterone to a hormone called, or an enzyme called SHBG, so that's sex hormone binding globulin. That's more inactive, so it's hard and more difficult for us to access and to use in the body. So when it comes to diagnosing PCOS, you should be off the birth control pill for at least 3 months before we do any blood tests. We should be using the free or bioavailable testosterone, and no ultrasounds for patients under the age of 18, because it's not very specific. So even if you do have cysts, we don't know if that means PCOS or not at that age. And if you don't have cysts, it doesn't mean you don't have PCOS, as they can develop later on in life as well. Now, when it comes to the treatment of polycystic ovarian syndrome, so this is the mind-blowing part, okay? So it's like their guidelines say, basically, if you're trying to conceive and you have polycystic ovarian syndrome, the first thing you should be doing before you even touch any medication, touch any surgical options, the first thing you should be doing are lifestyle and dietary changes for the first 3 to ideally 6 months. So what that tells me is if you have polycystic ovarian syndrome and you want to try and get pregnant, the first people you should be seeing are healthcare providers that are positioned to help you make those changes. So naturopathic doctors are key. So basically, between the lines, when I read that is you should be seeing your naturopathic doctor if you're trying to conceive and you have polycystic ovarian syndrome. So, IVF is beneficial for some patients, or using medicated routes as well, just to stimulate ovulation. But when you address the lifestyle and the diet, and we see there's a significant amount of research supporting this, that once we do these changes first, all of a sudden you respond to the medications better. All of a sudden we're seeing you produce more follicles during a procedure like IVF. We see that the quality of those follicles can be better. So these are pretty significant changes. And another really key test that I find not many people have tested is something called HOMA-IR. So it's HOMA-IR. The last IR stands for insulin resistance. So this is a very simple test. It's calculated based with two other tests. It's fasting glucose and fasting insulin. So I find most gynecologists will test for this as well, but your family doctor may not be familiar with that. So, something to ask about. But the HOMA-IR lets us know very specifically how insulin resistant you are. So say you have, 1 molecule of glucose, the pancreas may say, for simplicity, we're just going to say 1 molecule of insulin to help absorb it from the blood into the tissue. When you have insulin resistance, instead of needing just one molecule of insulin for 1 molecule of glucose, we might need 2 or 3, which is fine. We're still absorbing that glucose. However, that insulin actually tells the ovary to stop ovulating. So the ovary will have receptors for insulin as well. So it's something to have tested. And if you are insulin resistant, as Peyton's mom at 24, you've mentioned there. So the most important thing is, again, the lifestyle and dietary changes, which have been shown to help reduce that. And then the next thing that we should be looking at are the nutraceuticals or supplements, which have been shown to support outcomes with polycystic ovarian syndrome. So, huge amounts of research, but the most latest one, so published literally 2020, early January, looked at if women used L-carnitine for while they were using Clomid and metformin, which are common medications used to treat polycystic ovarian syndrome, versus women that just use the 2 medications, metformin and Clomid, but no L-carnitine. The treatment group that had the carnitine had a pregnancy rate 4 times higher than the group that didn't. So that's a pretty significant difference. And what that tells us is the role of nutrition, the role of nutraceuticals to influence not only long-term health with polycystic ovarian syndrome, but the short-term goal, so actually ovulating, actually having a positive pregnancy, is significantly higher. And that's something that should ideally be done in those 3 to 6 months while you're making all of these lifestyle and dietary changes as well. So polycystic ovarian syndrome is quite complex, but when we start, it's always with the same core core interventions. Okay, so with diet, and this can vary so much from patient to patient on what works for you, but it's important to have work with either a dietitian, a nutritionist, or a naturopathic doctor, help you kind of walk through the nitty gritty of it and finding what dietary strategies are best in the research and best suited to you, because sometimes it's best in the research but may not be actually what is best for you. Sorry, I'm just reading this comment here, and yeah, so there's a lot of other tests that should be done for unexplained infertility, and that's a live stream I'm going to be doing in I think a couple weeks as well. So we'll be posting about that as well. So I hope you'll join us for that, or at least watch the video for that. We'll go into a bit more detail about what kind of testing, because unexplained infertility, my experience is usually just we haven't done enough testing, so we haven't figured out what's the issue, and there are other things that we've seen in the research over the last 3 to 4 years that are quite significant to have tested as well, particularly with hormones, with thyroid function and the immune system. So we'll get into more details about that as well. So back to the polycystic ovarian syndrome, what they recommended for exercise is at least 5 times a week of having 150 minutes of exercise a week as the minimum, and at least 3 of those 5 workouts should be high to moderate intensity. So your heart rate should be close to 60 to 80% of your max heart rate, and you should be sweating. It shouldn't be just like a light walk or something. And then 2 out of those 5 workouts in a week should ideally be low intensity, so walking, elliptical, or fast walking or something like, or an easy bike ride at the gym, or if you're not in Canada and you're not covered with snow and ice, then you can go biking outside too. So that's really like the core things to look at with polycystic ovarian syndrome, especially if you're trying to conceive. The first 3 to 6 months are crucial to work with a nutritionist, a dietitian, or a naturopathic doctor. And this is based on new guidelines operating in almost 31 countries there. So that's quite significant. And worst case scenario, I always tell patients, if it doesn't help, you're just gonna have a healthier heart. Best case scenario, you're gonna have a better chance of getting pregnant anyway. So it's a win-win situation. You really can't lose with that. And yeah, so if you guys have any other questions, feel free to shoot me a direct message. Or if you have suggestions or questions about what you want to talk about or hear about in the future, I'm happy to talk about other topics. But in a couple weeks, we're going to be chatting about unexplained infertility. So we'll go into a lot more detail about additional testing and treatments for that. All right. Well, have a wonderful day, guys. As always, I really enjoy doing this, and it's my goal to provide you with information that you find valuable. So help me to do that. Help me to help you doing that. All right. All right. Have a great weekend, guys. Have a great evening. Talk to you soon.